round ligament pain during pregnancy. It's not fun, and there is a lot we can do to help you, so here it is. So the round ligaments are attaching from the front of the uterus forward, and there are one on each side. As the uterus grows from the size of an orange to the size of a watermelon, the round ligaments actually have to double in size. So that is a lot of lengthening, that is a lot of stretching. So there's no question why this might cause some discomfort for some people. But here's the deal. If somebody has an asymmetry in their pelvis, they are more likely to experiencing pain in their round ligament because one of those ligaments is tighter than the other. Your body is communicating to you that it needs balance. Another time we can experience too much kind of pain of the stretching in these tissues is if we're used to having more of a tucked under strategy. So think about when you tend to tuck your pelvis under, to sit in a chair, to sit at your car, etc., etc., etc. What happens is these tissues are very shortened anyway, and now because pregnancy is expanding things, these are feeling the strain of a deeper stretch. So here are some solutions for you to address that pain and that discomfort. Round ligament pain can vary from person to person, but here's some different ways that it can show up or manifest in your body. Lower belly cramping or tension, specifically in one side more than the other. Pulling or pressure in the pubic bone, a sharp stabby pain in the groin, or tugging in the vulva/vagina. So really those tissues are really going in towards that pubic bone. And so we can experience that pain and think it's something like pubic bone pain or pubic symphysis pain when it's actually round ligament pain. So let's look at how we can address that. This pain can come on suddenly when you do a quick movement. You might feel like a gripping or a pain or a twinge on one side or the other. Now let's look at some acute release techniques that can help address this pain, and then let's look at some ways that we can release it for good by addressing the imbalances in the pelvis. The bonus of this is the same stuff that help create balance in the system that can help eliminate this discomfort. Also get your body balanced and stacked and ready for a functional core system for a more easeful birth and a smoother postpartum recovery. So win-win. So to get your body more balanced so that you're not putting too much pressure forward on these tissues, one of the big things we want to do is we want to create a long, strong backside. That means strong glutes and strong hamstrings. One of my favorite ways to do this is through a hip hinge. So you can grab a weight, you can do this with no weight, and you can do a soft bend of your knee, and what you're going to do is you're going to hinge at your hips. Feel this stuff all lengthening. Now press into your heels as if to rise, so you're pushing in. Feel this all kind of kicking on. Take a breath in, and exhale, push all the way back up. So you see the difference between that and just this? So we're really thinking about finding that length and that strength. For this one, you're going to be on your back. You're going to place your hands at your side, and you're going to press your heels into the ground to slowly bring your glutes up. It's just a simple glute bridge, and this is going to help create some strength in the glutes. You can absolutely do a self-massage, so placing your hands on your lower belly, and you're just going to make some gentle sweeping motions. If you feel a spot that feels extra tense, just spend some moments just giving it some gentle movement. So what we're doing is we're getting into the fascia, and we're just communicating a signal to allow it to release. And then another great one is three-dimensional breathing. So if we can breathe and create space in the rib cage, we can help with lessening that downward pressure that's creating some tension lower in the abdominals. So you can take your hands to your rib cage, and we're not going to go low on the ribs, we're going to go really nice and high. And as you inhale, I want you to see if you can push your ribs away from you. And you can take 3 big sips of air, so it's going to look like this. And then let it go. 3 more sips of air. what we're doing is we're trying to get some mobility in the rib cage to get rid of that pressure that's getting pushed down deeper into that lower uterus.